Hi everyone, my name's John Holleran and I am Families and Communities Manager with Scottish Families Affected by Alcohol and Drugs. And Highland Alcohol and Drugs Partnership have kindly invited me to come along to tell you a bit more about our local improvement fund project called Families Are Recognised and Included. And the hope is that some of you might want to get on board, some might want to support us with this, and even just to promote and spread the word about what we're going to do. So I'm just going to share some slides with you to talk you through why we've been asked to do this work and what will be involved. And if you have any questions, please let us know. So I'm just going to share my screen with you just now so you can see the slides here. And hopefully you'll be able to see those. And so there we go. So as I said before, Families Are Recognised and Included as our Local Improvement Fund project. First off, for those who are not aware of Scottish Families, we're a national charity that supports families and anyone who's concerned about someone else's alcohol or drug use in Scotland. And here's the team. We're quite a small team, but we've got big aims and we work hard across Scotland to reach as many families as possible and just promote the interests of families where possible. We were established in 2003 by family members themselves who came together to support each other initially and then to campaign for recognition for support in their own right, but also in recognition of the job that they do, largely unnoticed in a number of ways to keep their loved ones safe and alive and thriving where possible. So we do provide national and local services and we reach family members from all of Scotland's 32 council areas. You'll notice there's a picture, I'm sure, at the Recovery Walk in Inverness under the banner of Love Makes You Family, and there's our 15th birthday cake a few years back. So hopefully that gives you a flavour of who we are. So most people get in touch with us through our national helpline, which is usually the first point of contact, and people are then directed and supported through a range of other opportunities, whether it be our telehealth support service, which is time set aside at regular intervals to take family members through our CRAFT process, which is the model intervention model that we use to help families. We also offer bereavement support, where families may have lost a loved one due to alcohol or drug use. We have a range of local family support services from Aberdeenshire, South Lanarkshire, East and West Bartonshire, and soon to start up, we're going to have a family support service in Inverclyde, where it's a designated support service that sits out with treatment for families in their own right. We do offer an extensive communities programme from our Connecting Families work. We're empowering communities, training and development, which helps to build family-focused and recovery-focused initiatives across Scotland. And we also offer a lot of workforce development and policy initiatives that helps to understand more about life from a family perspective. So what is the Scottish Families approach? So our new strategy, which was published in August this year, called Change Will Come, makes a commitment to ensuring that there are no more hidden families. We do know that a number of families often are working in the background to keep their loved ones safe and well, and that's often unrecognised. But we also know that families come in all shapes and sizes, and no matter how your family looks or is structured, whether you're related or not, what really makes family is the love and care and relationships between family members. And as Scottish Families, we welcome all families, whatever that might look like. So what is it we actually do? We work with family members to help develop their knowledge, skills, their confidence, and even capacity for self-care. But mostly it's about the connections that families need to continue to do what they do to keep their loved ones well, and where it's appropriate, be involved in their treatment pathway and help sustain recovery beyond services. We do know that a lot of people who use substances are not engaged in services, and sometimes families can be that link. The work that we do with families is underpinned by a rights-based approach, which is set out in Rights, Respect and Recovery, which we support families to have an active voice in, working with the government to understand the needs of families both in terms of their own support needs, but what role they can play in treatment with the right support as well. We do support the work of the Drugs Death Task Force with the Families Reference Group, and previously we've done a lot of work around stigma and families and communities as part of the Partnership for Action on Drugs in Scotland. Over the last year, we've had our own campaigns running, including Kinder, Stronger, Better, which looks at what family means and understanding that families are blended and different and all families should be supported, as well as our Behind the Numbers campaign, which really shone a light on the role that families play in trying to keep their loved ones alive, often when services are unable to cope with the demands or do not have the resources to continue to support their loved ones. So again, for more information on any of this, you can go to our website and have a look. And again, our main priorities are to ensure that families are supported, that they're included, that they're recognised, that they're connected to their communities, and also that they're a movement for change, which really leads on to the Local Improvement Fund project. Families are included and recognised. So the aim of the project is to scope the current provision of family support across Highlands, including the delivery capacity to reach families and support them, what models of interventions or support exist for families, and what are the links that exist between treatment and support for families. And we're hoping to provide a range of workshops and opportunities for practitioners, family members, people who have an active interest in growing family support and recovery, to help us kind of shape this work. So we're setting up a range of panels for people to come on board and help us develop the resources, the materials, help us reach people across the Highlands, and really just tell us what we need to be doing, because we don't have that local knowledge. Unfortunately, due to coronavirus, we do have to do a lot of our work online, because face-to-face contact and meeting up is prohibited. So we're trying to deliver this as best possible online, and we do have some people interested, but we want more people to be part of this work. So again, the outputs for this work is to ensure that we can develop clear pathways for family support, even if their loved ones are not engaged in any form of treatment, and to help them improve their knowledge and awareness of what can be done and to help move people closer to support and healthcare, ensuring that crisis is not the point of intervention, because we often see that that's the case. And we also want to find ways to reduce stigma, because we know that's a huge barrier to people accessing support and for people sustaining recovery. So again, we're going to provide these opportunities over the next year. The learning and development will take place between January and March, and we'll have a programme of learning opportunities that you can access if you sign up to our mailing list, or if you want to email me, I can send you more information when that becomes available. So really what we're asking is if you could help us promote this work, and if you would get in touch if you want to be involved, either as an organisation, as an individual, or you know any other families or communities members who want to take this forward and help us promote it, because the more people we're able to reach, the more impact this work will have. So if you have any questions, please get in touch. My email is john@sfad.org.uk, and if you want to find out more about any of the publications that are featured here, you go to our website and you can follow us on social media, and hopefully you can help us promote our helpline as the first point of contact for families. I hope you all have a fantastic event, and hopefully I'll get a chance to come and meet with you, or at least we can meet up and have a chat online. Thanks so much for your time, and thanks so much to Highland HADP for inviting us along. Take care. Thanks. Bye-bye.